Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, yes, it's Friday, and in its most traditional sense, a get-em-up out-of-town version of the show. We'll open it up to you at any time that you'd like to chime in here, sort of take over the thing. If it's in the form of a question, bring it on. Let's see what we can do with it. If I can't answer it, my listeners can. If it's a comment, anything you'd like to make, seen or heard recently in the news or elsewhere, give us a call on that too. The number to do that, 412-825-6262. That's 412-825-6262. It is open phone today. Of course, I have a number of things on my plate. I want to talk, about the Butler meeting last night. Yes, I was the featured speaker. Going to be talking about how things went up there. And some interesting happenings surrounding it. Also want to talk about things in the news, some neat articles that have come my way. Going to give you an opportunity, by the way, the big article, the one that I've been quoting from for years. And, of course, when patients come in to talk to me about cancer protocols, vitamin C, it rings in the air because that is absolutely high-dose intravenous vitamin C, a staple item. And the article I keep quoting comes from NIH. I want to give you the opportunity to have that article, have a pencil and paper ready. I'll tell you how to do it. And then launching the new program that was supposed to be launched last night. Well, I'll tell you how that all turned out, and we'll see how the show goes. At any time, remember, you can give us a call and take over this thing, commandeer the thing, drive the bus. I'll just sit and be a passenger and let you bring it to us, 412-825-6262. Now, calendar-wise, shaping up like this, folks. Next Wednesday, we have a young lady in our midst, because I've never met her before. When I was talking to the PR group, this is a group located in Florida, and they really have their tentacles out all over the country. That's how we get some of the fantastic guests we get by virtue of the PR group. And so they called me and said, we got a new guest for you. You'll just love her. She's so exciting. And they tell me about her. And as they talk more and more, I say, hey, this is a girl who's right here in Pittsburgh. Anyway, her name is Joanne Spence, and she's going to be talking about yoga. She's written a book entitled Absolute Beginner Yoga. We can subtitle the show Yoga 101. Evidently, she's used yoga for some of her own personal crises, big chronic pain issue that came up, but evidently has really delved into this in a way that's now made it become a career for her. She participates in something called Yoga on the Square, right here in Pittsburgh, in the Regent Square area, out there near the Swissville area of town. And, I'm going to be looking forward to having her with us on next Wednesday. Next week, of course, is an abbreviated week here. You've got some festivities coming up. Thursday, of course, is Thanksgiving. We'll do a repeat show on Friday, by the way. If you have an idea of a show you'd like to listen to again, and you think you want to bring it to us on the air today, just give us a call and just say, hey, I'd like to hear the repeat show, and mention the, you don't have to mention the date because I think I can figure it out, but just give me some idea of who the guest was, and we can play that show, because there absolutely will be a repeat on the 25th. We'll be coming back. We got 2 shows in November, as yet not scheduled, but you'll see how that'll fill up. And then we do turn the page, coming up very shortly, to move into the month of December. Of course, David Bronstein on the 2nd of December, talking about his book, where did I put this thing? Anyway, drugs that don't work and alternative therapies that do, or at least I'm paraphrasing it. And then Susan Smith-Jones will be our guest on December 7th, talking about how not to get, or if you have a hangover, what to do about it. She's always timely and evidently feels that the holidays bring weight issues and not feeling too good, maybe a little too much imbibing. Anyway, that's on the 7th, and that's how it shapes up so far. I'll let you know as we keep filling in the gaps. Now, things happen around the office here, as you should well know. MCG testing well underway. You're out there as a listener, and you're not really one of the patients here. Don't feel like you can't participate. I put this out to you and say, invite you. Come on in and participate in MCG testing and learn what the status of those coronary arteries are. I have a penchant for, I've always moved and been devoted to cardiovascular concerns. This little device has taken it to a new level to learn with precision how much plaque you have in those arteries, if, by the way, any at all. Because we do have patients that really reveal to us that their arteries are completely clean. That's not the norm. Finding out to what degree of plaque deposition has occurred in those arteries is usually, in no small task, quite a dangerous predicament, because usually the only way you can find out is through a cardiac catheterization. For goodness sake, nobody should, first of all, nobody does want and would want one of those, but who wants to go with the risk of something like that when you can have, in a pretty leisurely way, a 6-minute test performed, lying on the bed in a...
You're listening to 620 KHB. We'll be back with today's program in just a moment.
Dr. Courtney? Hello?
Hey, what happened?
I don't know.
How am I coming through?
Yeah, it just disappeared for some reason. Let me patch you back in here.
So you're getting me loud and clear now, are you?
I am now. Yeah.
Okay, at what point did you lose me?
I'm not exactly certain. It just kind of dropped out right then and there. I don't
All right.
have any explanation for it.
Well, it's a little crazy, but all right, I'll take it again.
Okay.
Okay. Oh, hey, folks, I don't know what... Halloween's in the past. Nothing scary coming up. Electronics sometimes go awry. And, somebody either pushed a button or flipped the lever, and we lost you there for a moment. We're now back. I was talking about MCG testing. We got the program well launched now. The next place to go, of course, is our Monroeville venue. We're going to be starting there next week, next Tuesday. If you live in the Monroeville area, or at least all points east of the city of Pittsburgh, and found it very difficult, as I could understand, to be able to get MCG testing, you come all the way out here in the South Hills to do it for this 6-minute test. I am with you. I understand it. For that very reason, we're now coming back to the Monroeville area. We were there once many moons ago whenever Dr. Caminos had an office right on Mossite Boulevard. He outgrew that office, and by virtue of having no space in it, we really had to prematurely leave. We hated to do it. He hated to see us go. But now that he's in newer facilities literally across the street, we have returned to the Monroeville area. We're coming to you with MCG testing starting next Tuesday. Now, if you'd like to come on in and be tested, of course, this is an insurance-covered matter, completely fuss, no muss, no fuss. 6 minutes later, after we start the test, it's over. Give us a call here at the office, 724-942-3002. We'll slot you in for next Tuesday. And by the way, we'll have continual monthly time frames to let you do MCG testing, either for the first time or the repeat testings that do come up. MCG testing, now back in the east of Pittsburgh in the Monroeville area. Hey, we do have a knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind?
Hello.
Hi.
I'd like to know what MCG stands for.
Oh, yeah, that's fair.
Is there radiation involved?
Oh,
How
my
much
goodness.
it is?
You know, no, there is no radiation. Thanks for asking. Sometimes the most important question to the listener, I just gloss over and don't mention. First off, MCG testing, from your perspective as a patient, involves nothing that can harm you. It is strictly an electronic sweeping of you in a fashion as if you were taking an EKG, okay? Now, EKGs take about a minute. The MCG, which, by the way, stands for multifunctional cardiogram, okay? That's the 3 letters there, is a test where you just lie in a bed. They put clips around each of the ankles, each of the wrists, that's 4 clips, and then 1 sticky lead off the side of the chest, left side, and then over a 6-minute period, this device just keeps sweeping you. You know of nothing. You're lying very still on the bed, quite comfortable, I might add, and then when the 6 minutes is up, the test is over. The data that is acquired is really obtained in the computer program itself, which we then send those results to get analyzed at the end of the day and compare your results to a database of 42,000 plus patients who had this test before, who were actually sick and had cardiac catheterizations done too. Now, we don't want you to have a cath, but we can compare your data and be 91% accurate by determining what the status of your coronary arteries are as if you had the cath without ever having to have a cath. Fair enough?
What's your brain arteries?
Well, this particular device is going to be not revealing anything at all. Excuse me, 1 minute. I cleared my throat. About your brain arteries, except to say this, that arteries are not islands unto themselves. Usually, there's a sufficient amount of plaque in the coronary arteries. There is equal amounts of plaque in other areas of the body, including the brain, including the lungs, including the kidneys, and many other arteries in the body. But these set of arteries, the coronaries, have special consideration because everybody's worried about the status of their heart.
The reason I'm asking is I had a stroke.
Uh-huh.
Supposedly my coronary arteries are relatively clean, but I have very tiny, 0.5 millimeter arteries in one side of my brain, and I had a stroke on that side.
Well, you know, we can talk about the personal nature there. The arteries that go to the brain, there are 4 of them, 2 carotids and 2 vertebrals. The carotid arteries are easily enough assessed through a study called a Doppler. You had to have had these done, right? Have they done Doppler studies of your neck before?
Yes.
Okay, and so they are the arteries that you're most concerned with, and I understand it. And if you have an anatomical anomaly going on where there are arteries that are just, that from birth are a little tinier than the other side, which is what I gather from your comments, that you would be predisposed to developing problems on that side of the brain. And for you, you would want to make certain that you can perfuse the brain on that side better, in a better way than that could be done, in as best a way as it could be done. And so I've got plenty to talk to you about. Please come in and see me to make certain that you do accomplish that. Now, MCG,
do we get written reports and the graph or the angiogram? I don't know how to call it.
Okay, well, let's just say there obviously are reports that get generated, objective reports, qualifying and quantifying reports on both sides. The MCG tests, as well as Dopplers, as well as some other studies that can be used for detecting difficulties in the arteries of the body. They all, when put together, bring the picture much clearer into focus. If you had a stroke before, I would ask you, was that stroke hemorrhagic or was that ischemic, or don't you know?
Ischemic.
It was ischemic, based on the small caliber of blood vessels on one side.
Lumbar kinase and hematokinase.
Well, you are certainly keeping, with those 2, all clots cleared, and I hope you're sliding up those places.
I don't know if they're cleared yet.
Oh, well, let's just say that there is the only clot-busting substances that I know are found in the alternative realm. They're not found in the conventional world. And you just talked about the main 2 of them, nattokinase and lumbrokinase. Over a time period, and how long have you been taking this, by the way, ma'am?
A couple of years.
Oh, good. Well, by a couple of years, let's just say that the clot busting process is well underway, and you're literally maintaining it with the current dosing that you're on. What's the kind of dose that you take every day of those, ma'am? How much are
I don't know. I take about 2 pills. I don't know. I didn't look at. I'll have to look at.
Oh no, don't worry about the milligrams. Don't worry about that. The Luca comes in a way that I know what's in the pill. So you take 2 of those a day. Is that right?
Yeah, at least. Mm-hmm.
Okay, and that's certainly an adequate amount at this stage of the.
What if you take them with meals? Do they just help you with digesting?
Yeah, I would say better on an empty stomach.
I know that,
Mm-hmm.
and sometimes it's hard for me to do that.
Oh, hey, you try as best you can, but the most ideal way, as the label reads, is on an empty stomach. Now, if you can't do that and you're doing it another way, you are limiting the benefits from that particular dose. But hey, hectic schedules as they are, you do what you need to do. At 2 years now, I can assure you that these arteries are in excellent shape in terms of the clot component.
Well, about a half a year ago, it was no different.
Oh, but from the plaque component, they can't measure the clots. Excuse me. You got to get everything straightened out. Could you please come in and talk to me so we can get this straightened out? I see you have a lot of angst, and you need to put a lot of this to rest so you feel a little more comfortable about the whole thing. And if we can put this in the right perspective, I think we can get you to that point. Because there's no assessment. I mean, the natto that you're taking doesn't diminish the amount of plaque. That natto and that Beluca diminish the number of clots, the level of clotting around that plaque. They're 2 different things. So we need to talk about, as I think you've just told me, how do you get rid of the plaque? Because what you're taking, at least when you're telling me right now, will not do a thing for the plaque, but there's so much you can do for it. Please come on in and see me so we can talk about it.
Okay.
Okay?
I would like you to discuss what can be done.
Oh, I've done it many times, but let's just say from plaque, this is a quick answer to you now. There's only one way I know to remove plaque, and that's through something called chelation therapy. Are you familiar with it?
Yes, I am.
Okay. Do you do it? Do you practice it?
I have done some.
Okay. And that's where I believe you need to pick up the gauntlet.
IV chelation therapy?
Well, it depends on how much plaque you have there, ma'am. I'm going to cite one case for you because I never forget this woman. She came to me early on in my alternative career. It's about 1996, but a woman came to me with a terrible concern. She was told that she had to have carotid endarterectomy, which is a surgery to remove plaque from the carotid arteries. It is, I want to tell you, is a risky surgery. It's nonetheless, it is the surgery of recommendation when you have, and in her case, she did have 90% plaque in her carotid arteries. That's a pretty substantial amount. And so when she came to me, she said, look, I'm told I need to have a surgery. And I said, you know what, your doctors are telling you right. You absolutely, with 90% plaque, have to do that surgery. You got to do it. She said, I don't want to do it. Is there anything I can do to try to avoid that surgery? So, in the early days of the chelation therapy that I was involved with, I said, look, I'm not sure how well this will work, but you got to promise me this. I'll be very aggressive with IV chelation, because at that time, ma'am, that's all there was. There was no oral chelation going on, and there is oral chelation today, but then there was none. So I said, look, if you will be very aggressive with this, you have to promise me, and I will work with you, after 6 weeks, you will go get another Doppler of your neck to see that you have had improvements. And you must promise me that if you don't have substantial improvement, that you'll go ahead and get that carotid endarterectomy. Well, she made the deal, and she held her end of the bargain. And so for the 6 weeks that we had figured out that that was going to be our plan, she was there 3 times a week doing IV chelation, which is very aggressive. Usually people just do that once a month or once a week at best. At the end of the 6 weeks, we sent her back to get an additional Doppler. And I never forget this. I cherish that study. I carry it in my files, and I look at it every so often. What was 90%, 6 weeks later, it was 46%. Ma'am, I don't know of anything that's possible is out there that can do that. And so that is when somebody is very aggressive, and here you are, you're not doing any chelation therapy at all now, and you're very concerned about the amount of plaque in those vessels of yours. Let's talk about a plan that you can get into, and let's measure your improvements, because the Beluca and the Beluca, which is lumbrokinase, and the Natto, aren't working on the plaque at all. That only works on the clot. They're two different things. So, please come on in and see me. I'll be happy to answer anything else, and I'll lay out that plan.
How much?
Ma'am, come on in and see me.
MC. How much does it cost?
Oh, that's insurance covered. Don't worry about that. Yeah, it's covered. Sure it is.
Medicare?
Oh, yes, absolutely.
Okay.
Please, come on in. Number here is 724-942-3002. We'll discuss the whole array of issues, all right?
Okay,
Thank you for your interest. I'll be looking forward to seeing you.
Bye-bye.
Okay. A lot going on with blood vessels there, ladies and gentlemen. A lot. Okay. Let's do this much. Let's take a short break now that we've maintained our contact with the radio station. Come on back. I want to talk about the Butler meeting last night. It really turned out, I'll explain to you. Started out really sour. Turned out excellent. We'll talk about that when we return. And also wait for your knock on the door, 412-825-6262. Be back in a moment.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I gotta go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shakes. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Out here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday version of the show. It is the traditional Friday, get 'em up, out-of-town version on this pretty chilly Friday morning. Things are going to brighten up this weekend and get a little warmer, too. Go figure. We're in November. Hope you're looking forward to that weekend and hopefully allowing us to get out of town with the excitement building up to the end of the show. Now, we open up to you today by saying give us a call at 412-825-6262 if you've got anything on your mind. We do have a knock on the door. Come on in the store. Hello and welcome aboard. What's going on with you?
Hi, Dr. Courtney.
Hi.
Just first a comment. I appreciate your unique long form, as they say in talk radio, long form, covering of topics that are cutting edge in health and bringing on different guests regularly. It's unique out there, and that's really outstanding.
Thank you. I really enjoy doing it. I've been doing it quite a while, but yeah, I can't do this show talking so much about me. I gotta bring on the guests and get the experts, and that's just the way it's worked out over years. So I pledge to you that more of the same is on the way. If you enjoy this show, we'll be bringing you more guests, and as we always have done. And so keep on listening. I thank you very much for those nice comments.
There's been two periods of time over the years where I got in the habit of being able to listen for extended periods. One was earlier this year. One was a few years back, and I guess with health, you make like mental notes. Even if you don't have that condition, you try to understand it in case something acute pops up. Well, one of those things has popped up for me, and it was something you covered years back, and I didn't hear it earlier this year. And when I heard it years back, it was cutting edge to me, but I never heard the guest. I guess I didn't stay with you long enough. That would be root canal issues.
Uh-huh.
Now, in my case, I had a root canal done probably about 6 years ago, and I think the tooth also cracked. Now, the dentist he thought it was worth saving as apart from pulling it, and so he put a crown on it. Occasionally, I think there's a flare, or not just occasionally, I think there's gingerness, which I know over time isn't healthy because, the gingerness tends to set into your system, and thus you can only probably be delicate for so long before that starts taking a toll elsewhere. Now, I remember the thing with cancer is on the opposite side of your body, and, it seemed like in the limited time I heard you back then was at least related, whether one was the cause of the other or whether something else was causing both. It seemed, too much to be coincidental, at least from the limited I heard. But what are your thoughts on, again, and now I have an abscess, and so the dentist said with antibiotics, which I didn't want to take, I was looking for something natural, antibacterial, and I know there's things out there, but antibiotics even, he said, it tends to come back, so he wanted to drill through the bone to remove infection, and I know that's not the natural way to remove infections, because he said antibiotics, it always comes back once it's out of your system.
Yeah, I'm getting a real clear picture here. Why don't we take over here for a bit and see how we can help you out?
Yeah, just is removing the tooth the best solution?
Yeah, let's get into the root canal issue. By the way, it came up last night too, so it frequently does come up here, and although you may have gone through periods where you've listened to clusters of shows, and then periods where your schedule just wouldn't allow for it. The issue of root canals is a staple item here in dentistry. Root canals are one of those things that's done that turns to have usually long-term consequences, and in this sense, the short-term consequences are there. When you get a root canal done, they actually bore down in one of those roots deep enough that when they instill absolute alcohol in the hole, the tooth is rendered dead. It is dead. The tooth is killed on the very first day that the procedure gets done. And so the painful reason that you went and saw the dentist usually is why the root canal was done to begin with, and then immediately upon having done it, the pain is something that goes. It's gone. Now look what's going on with you. The pain really is that you're having discomfort in that tooth. In fact, if I hear it right, it's even being questioned you have an abscess in that tooth, if I'm hearing it correctly.
Yes, an abscess now, and gingerness, I'm thinking from the cracked aspect. I did it once when it's still numb.
So you got two things going on. One, you have a dead tooth, which even if it was a successful root canal, which in this case, it doesn't appear as though it was, there should be no infection and there should be no continued pain and discomfort in the tooth that has been root canal. So mission was not accomplished there. And but on the long run, the problem with the root canal that we were always talking about was that this dead tooth is going to decay and rot right in your mouth, and the anaerobic bacteria that are going to be responsible for that decay and that rotting have health consequences. And one of those health consequences, according to both Hal Huggins, who came in with a dental component, and Robert Dowling, who came in with a thermographic component, is that there is a connection between root canal teeth and cancers. We've elaborated on this subject very, very frequently. So frequently, in fact, that we encourage people to get thermograms done of their head and face to be able to identify whether or not a root canal should be removed. In your case, sir, it appears, without much thought needed, that that particular tooth needs to go. If it was a successful root canal, you wouldn't be having the infection component that you're having now that has been described as an abscess. You would ultimately have had to contend with the harm, the chronic harm, the long-term harm, which is the potential risk of having serious health consequences and even a tie-in with cancers that has been pretty much well established by other doctors that we've had on our show. So the answer to me at this point are quite clear. Had you not even told me that you had abscesses going on, I would tell you you need to get a thermogram to see if you have a subclinical infection, and if you do, you'd have to have the tooth removed. But you didn't just tell me that. You said, hey, I'm having a heck of a time with that tooth, and my dentist says I have an abscess, and he's thinking about drilling down a hole in the bone to relieve the abscess. If there ever was a tooth that was tapping you on the shoulder, literally smacking you behind the head and saying, do something about this, the something that needs to be done, as I see it, is that the tooth needs to be removed, and removed now.
2 follow-ups on that then, because, once it's done, it's done.
Yeah.
One, the thermogram, is that just for subclinical infections? Or
yeah, we don't need, right now, I can tell you that the thermogram would be useless, because it would light up so hot now, because you're having a clinical problem. It's not subclinic at all. You have pain, discomfort, and an abscess going on. So there'd be no doubt on how bright that thermogram would be over top of that tooth. We find that the thermograms are helpful when things cool off, okay? And so I have people that have root canals 30 years in the making, and they go ahead and get a thermogram, and if you ask them, do they have any oral sensations at all around any of their teeth, they would tell you no. Yet, when they get a thermogram, because it's so doggone sensitive, it does light up like a Christmas tree, 10, 15-watt bulb right there, and it proves that subclinical infection needs to be dealt with by extracting the tooth anyway. In your case, just by listening to the clinical stuff here, that tooth needs to come out. Now, your dentist is going to feel that rescuing the tooth is the goal. That's the way dentists think. You need to save the tooth at all costs. They won't appreciate your discussion about root canals and how harmful they can be. They're just not trained that way. They don't think that way. But for the long issues, the long haul issues that should have been ultimately dealt with, but now in the short term, it looks like their time has come. You're going to have to get that thing removed.
What do you watch for any follow-up thermograms, say, after this tooth would be removed?
Well, one thing I would say is when this tooth gets removed, it actually should be removed. You may have a little bit of a battle with your dentist on getting this done, but
no, he'll do it.
Okay, all right. So what you need to make certain that he does, please ask him this, because he can do it. It's just that if you don't ask him, he won't do it. And that is, you have to say to him, please, would you take the time to make certain that you've removed the periodontal ligament.
Okay.
Got that? Because that little ligament, the remnants of which are still present, is the structure that connects the tooth to the bone.
Okay.
And in sort of a 50-50 proposition, half of the time when you extract the tooth, the ligament stays adhered to the tooth and comes out, which is good and presents no problem. The other half of the time, it stays adhered to the bone and stays in that hole, which will be a problem. So unless, and I can tell you that the normal practice in dentistry is just to leave it alone. They think it resolves. They think it goes away. Well, it doesn't resolve. It gets worked on by those same doggone anaerobic bacteria, and it forms a cavitation. If the ligament gets removed, and all he needs to do is take a burr, which is the name of one of the bits that he puts on his drill, and just goes around the periphery of the bone with that burr, he'll be able to remove the ligament. You'll be none the worse for wear because while under the local anesthetic, you'll have no sensation anyway. But he's got to remove that ligament. And then you'll have no trouble with that particular tooth ever again. Now, if you have other root canals or other dental extractions, after about, we say, 6 to 8 weeks, everything should normalize, and that's when you get a repeat thermogram to check on the status of that tooth as well as every other tooth in the mouth.
And what would I be looking for on the thermogram?
Well, you'll be finding, you're looking for hot spots, and usually in the write-up that is provided to you by the people who actually read these things, they're radiologists that are trained in reading thermograms, they'll tell you whether you have any dental lesions, meaning do you have any infectious teeth signatures in the mouth at all. And if they're there, you'll see them. It won't be something that is difficult for you to see. It'll be clear as day, and then you'll see the note made by them when it comes to assessing the mouth and face and dental structures. So it would not go missed. If there are continuing issues with the dentistry, it will be revealed because the doggone infrared camera is so sensitive that it picks up even the slightest temperature change and reflects it in this red color that just can't be missed. It's just so obvious. Okay?
I know once you remove something in the body, everything has a purpose, such as, when they remove appendixes, there's a lot of NDs or things are fine. There's lackings in the system. Is there any lacking once you remove a tooth? I'm sure there is, but anything to conquer that?
No, I would say not. There are plenty of people out there that are completely edentulous. It's the mastication component that has to be the number one issue, and so something needs to go in the hole, not in the hole, but sort of above it. They use crowns and bridges. They construct a prosthetic device, a tooth, that fits in that gap and hooks to the tooth in front of it and the tooth behind it and allows you the best mastication possible outside of your own teeth. But this particular root canal tooth is really a problem, and rather than ultimately having to confront what might be the need to remove the tooth anyway, if there ever was this acute problem coming up, if a hot spot would have to be identified either now or 10 years from now, the recommendation for me would have been to remove it. But with the problems you're having with it, and the fact that that the root canal tooth is dead anyway, in this case, it's quite an easy call for me, a non-dentist, because I'm usually the one that has to write a prescription to a dentist to tell them to remove a tooth. And oftentimes they look at me and bewildered. What do you mean remove the tooth? They get very upset with me. That's why I usually can only send to a couple of dentists that understand what my request is and why. So I would easily write that prescription for you now, listening to what you said.
Better to leave it empty or go with a false tooth in?
Oh, you want to have the mastication component available to you. I mean, I don't know exactly where this is a molar, is it not, on the back teeth?
I don't know the names of teeth, but second to back on the top.
Okay, so that's a molar. Those are your grinding teeth, and when there's a gap in the teeth, it does affect the side of the mouth you're going to chew on, and you need to try to maintain mastication and your ability to break up food in the mouth as best you can. And so it's easily enough handled dental-wise by using crowns and bridges. It's quite a common practice, and your dentist would be able to fit you with such a device, and you'll get along quite nicely with it, I'm sure.
Thank you, sir. Appreciate it greatly.
Absolutely, my pleasure. Keep on listening.
All right.
Okay. Who'd ever thought? Root canals, huh? Came up last night, too. Hey, about last night. And still offering you the opportunity to come on in today if you got a special issue you want to bring to my attention. 412-825-6262 is the number to do that. That's 412-825-6262. Well, waiting for a knock on the door, I just want to share with you the sheer enjoyment I had last night up at the Butler Group. We call it the Butler Group, the Freedom of Choice in Cancer Therapy Group. If any of those of you who are up there are listening to me now, I want to just tip my hat and thank you for having invited me and the enjoyable time that I had that really, at the beginning of this, I didn't think I was going to have. First of all, to get to you, which usually is a chore, I was unaware of all this problem you have up there in the Cranberry area with you got construction going on. And so I was on a real tight thread of time, and I hit that Wexford area. And if those of you who live in the north side of this town know what I then ran into at about, 6:30, 6:20, 6:30, you can imagine this wasn't pretty. Well, not much you can do about that. Having arrived late to the venue at the Freedom of Choice and Cancer Therapy Group, days in there, supposedly to start at 7, I believe I arrived at about 7:15. And thank goodness, and I always enjoy seeing him, Dr. Roy Carey stepped up to the mic, and was taking care of the crowd while awaiting my arrival. It was so nice to see him, and I'm sure that what he shared with the group is so unique, because Dr. Roy Carey is just that unique. Anything that comes out of his mouth, I know. I got a pen and paper and I'm writing it down every single time he speaks. But as usually happens with plans, things went awry real quickly. I call it my deja vu moment all over again. And here's what I mean by it. I think I revealed to you on Wednesday that a number of years ago, when I put together that presentation on the 7 deadly sins of conventional medicine, the first time I was going to give that presentation was at a special seminar given by Faith Golagowski at the Holiday Inn in Greentree. And when I arrived to give it, we had no way of projecting those slides that I made onto any screen. The device just wouldn't work. And so I had to give that presentation completely a cappella to a packed house. And you know what? It went off pretty well. But those were those well-laid plans that didn't work out. Well, that's what happened last night. I arrived to do the same, found out that we had no device with which to shine those little slides up on a screen, and then in that same deja vu moment said, well, push it aside and start to speak a cappella again. What happened as a result of it turned out to be something completely unintended. This neat little, it was a smaller group. It got very intimate, and over about a 2.5-hour period, just started to let it fly. And so with no rhyme or reason and multiple questions coming from this group, what I had planned for and had no opportunity to even complete my plans turned into something that only happens very rarely. If you were in the group last night, you know how rare of experience that really was. I felt it. I got the feeling from you that you felt it. And so I want to thank you once again for making that such a wonderful experience for me. I hope that you enjoyed it too, and I look forward sometime in the near future to back up the Butler again. When the Wexford exit to 79 is repaired, I'm not going back up there until it is, and hopefully arrive with plans that have been set that were able to be maintained instead of having to relive another deja vu moment. Again, thank you, Butler. Hey, we have a knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind?
Yes, good morning, Dr. Courtney. I have a couple quick questions here, some notes I made over listening to a lot of the shows.
Okay.
The first one is, the minerals that we're drinking, the contrast trace minerals.
Yes.
When you read the write-out on there, and I do know it's in trace, did you ever look at the write-up? I mean, there is antimony, there is tin, there is nickel. Now, of course, I'm not mentioning all the good ones, the copper, the cobalt, but there's titanium, the rhodium. So those are a lot of things I try and get out with chelation. So I've always wondered about all those little other bads, or all those little minerals that are in those trace minerals.
Now, you're talking about the trace minerals that come from the Great Salt Lake that we had here, and we did about.
It's the company with the guy advertises who comes on, who got rid of his heart palpitations.
Oh, yeah. Okay. Those are absolutely.
Before you start talking about them. So I was just always wondered about all those other minerals in there.
Yeah, I'm sure that there are minerals that are not, that are, you talk about trace, that they just can't pull out of there. I think that whenever you look at the write-ups on any of these, they talk about 99.5, 99.9% pure. They can't get it to 100%, but they do filter out, and they're able to remove the 99.9. I know that for a fact that the amounts of these other minerals that certainly wouldn't be minerals that you would want to have in anything were unavoidable to get the trace minerals that you do need to be included in the, I think, what is it? What do they claim to be? Like 80 plus, I think there's 85 different trace minerals in there, and you're getting some of the bad ones, but that is already refined and already been purified to the point to get it there. But they have to, by law, state what is included. Not that is, because at that point they can't measure it anymore. They just have to say what can be found, and then they have to mention the harmful ones as well as the good ones. But this occurs in any trace mineral. I can give you another scenario where that happens, and that would be in fish oils. Now, I don't use fish oils anymore, as you would well know, but in fish oils, they remove mercury, and they'll proudly state that it's mercury-free. And so if you read the label, you would, say this is the kind of mercury I want to use, and I would be the kind of mercury, kind of fish oil that I would have had you use. Problem is, you can't ever remove 100% of that mercury. And so even when they went and subjected the substances to a system that would remove the mercury, it can't remove 100%. It can only remove 99.5 or 99.9, and puts that small, minute amount of the mercury, allows it to remain, because there's no process that can get out 100% of it. I hope that explains maybe why you can see these teeny amounts of metals that you really don't want to have in a product that's trying to give you healthy metals. Well, they have taken and removed all of the contaminants that have been possible, but they're just a small, minute component that's never possible to remove. Okay, next question.
All right, the next question is, this is a question that's puzzled me. I'm 59, and my hair is not all gray. But I see some of these guys, a lot of them Asian or Hispanics or whatever, they look like they're in their 70s with a full head of black hair. And I'm like, do these guys dye their hair, or do they just have the no-gray genes? And I noticed from your pictures on your...
Oh, yeah.
Your hair is pretty dark.
Yeah. Well, you can color that, too, so don't let that fool you. But
do you dye your hair,
that's
or
either...
that's just natural?
Oh, I've been known for to get a touch-up or two, absolutely. But when it comes to the graying process, I began graying very early on in my life, and I know other people that do. I also began shedding hair early in my life, so get the double whammy, so to speak, okay? But in terms of the genetics that lay fodder for why your hair should turn gray, there is a genetic component. I will say there are hormonal issues that help hasten that and turn that to a level that I think ethnically you're right. There are some of these ethnicities that just don't get gray. Very few people get gray. You get full heads of hair, and that happens to do with the fine genealogy that gets passed on within that particular genetic subset. And then there are these hormonal problems. For instance, one of the questions in my thyroid questionnaire is premature graying. That's absolutely associated with low thyroid disease. And because you were born and raised, you're a Western Pennsylvania guy yourself, yes?
Yes.
Okay. Well, born and raised in Western Pennsylvania, and having no iodine in your soils, just like in my soils, we had no iodine growing up, and we have a thyroid issue, normally subclinical, but one of the manifestations could absolutely be premature graying in our population, Western Pennsylvania population, based on the thyroid issue alone, let alone the myriad of other possibilities. So I can't state that it for sure is due to this, but I don't know, do you take iodine supplementation? And if you don't, even if it doesn't have a thing to do with gray hair, it certainly has something to do with having your thyroid function correctly, and would be a supplement that I would encourage all men to take. I know I certainly do.
So you're saying it's possible when you see some of these guys, like maybe 70, to have a full head of black hair? That's possible to, at that age, still have all black hair?
Oh, yeah. Do I know them too? Absolutely. Is it possible? I have evidence of it every single day. Now, do I find a full head of hair and non-graying hair in a high percentage of people? Oh, no. No, that's very. This is like a unusual item. It is interesting, however, how certain ethnicities seem to do very well in this regard, and so based on hormonal process, genetic processes, and a whole bunch of others, that entire genetic segment appears to do rather well. I only brought up one particular case as a Western Pennsylvania individual who lives and was raised in the goiter belt. You've got a thyroid draw that changes color of the hair, and as I say, is one of the 20 questions I ask when it comes to determining whether somebody needs to be treated for this thyroid disease. Premature graying is one of the signs of low thyroid. It's one of the top 20. Out of the 80 symptoms, it's one of the 20 questions that I ask. So, I pass it on to you as maybe an explanation. We can sit back with envy and enjoy, for them at least, the fact that they're able to get through this lifetime with that full head of hair and have it just cropped up and black and beautiful or dark. But that isn't in the cards for the majority of us, at least. Too many things weigh into this to make hair turn at least gray. As far as the balding process goes, that's a genetic issue pretty much clear, tried and through, and it's tied to testosterone, believe it or not.
Doc, since you mentioned hormones, now, as I've gotten older, and I'm 59, men start getting all that hair all over their back and arms and ears. Mm-hmm. Is that good, or is that a hormone imbalance?
That's hormonal. That's hormonal all the way.
All that excess hair on your back and stuff that you never had when you were younger.
Yeah, that's hormonal all the way, mostly related to testosterone.
Lack of testosterone.
A diminished amount of testosterone as you're aging, yes.
So if you took testosterone, it would, that hair...
The hair, in the case of when you have a depletion of testosterone, you get the absolute opposite effect that you think would occur. I know women who get put on testosterone, they say to me, hey, I'm not going to get a beard, am I? Or I'm not going to get, dark and mustache. I'm going to say, well, no, if we keep this into the right levels, you absolutely will not, because they feel, and they are correct, if you take too much testosterone, you will get very coarse hairs develop all over the body, and especially in women, it's a big concern. But in a sort of paradoxical fashion, as we age and we lose testosterone, hair growth gets very erratic and begins to develop in places of the body where heretofore it has not, and it grows like, haven't you ever noticed a person who has an eyebrow and has like 3 or 4 hairs that look like they're 4 inches longer than all the other hairs, okay? That wild hair, so to speak. All testosterone related, and a depletion of testosterone is what causes that. You got another question for us?
No, that's it. I've just been wondering, where's that guy Danville who used to call all the time? Is he still alive and kicking?
Danville. Oh, yeah. He goes in spurts, too. Sometimes there's about 8 shows back to back. He gives us a call. I got people telling me, I'll meet him on the street, would you tell Danville not to call, okay? I like Danville. I really enjoy Danville, and I haven't heard from him in a while either. By the way, Danville, if you're listening, and he usually does, give us a call to tell us how you're doing. Thanks for mentioning Danville.
I was wondering how your shoulder was doing.
Yeah, me too. Thank you very much.
All right, thank you.
Okay. All right, there you go. See how this works? Just keep ticking off questions, and very happy to answer those questions. We got a couple minutes left. Literally, as we're in around that home stretch, 3 minutes left to go. What did I want to mention? Oh, Dr. Roy Carey up there. I want to mention him because we were talking after the presentation, and we're bringing Dr. Roy back on our show. He is he's board certified ENT doc, ear, nose, and throat. Allergies and the treatment of allergies has been something he's been intimately involved with his entire career. He has a new approach to treating allergies. He tells me that if I come up to his office, he'll train me and know how to do it, and I wouldn't accept training from anybody else with allergies other than Dr. Roy Carey. He's been so influential in my development, and he is my mentor on thyroid disease. He is the guru. He's a real guru, folks. Anyway, we're going to be bringing him back soon. For those of you who have allergic conditions, talking about what he refers to as low-dose antigen, and I promise you the next few weeks we'll have him scheduled. I was having him go back and check his schedule before we inked it. What else? Oh, vitamin C. I went up there last night with the intention of having the article on vitamin C that I've used now for a number of years available for the Freedom of Choice in Cancer Therapy group to pass out. Now, after arriving late, as I did, after having a deja vu moment all over again with nightmares of not having my slide presentation available to show and having to start a cappella fashion again, I got overwhelmed with the switching of gears, which you and I know we do quite a few times around here, and I never did get to offering it to those who were there. I wanted to make a special mention. If you think that you'd like to get a copy of this article, I use it as literally a Bible around here when I'm talking about the treating of cancer with high-dose intravenous vitamin C. The article that I have comes straight out of the federal government, and it's from NIH and NCI, and it absolutely proves beyond a shadow of a doubt at those cancer research facilities that in fact happened. Self-addressed stamp envelope with that request. I'll be happy to send the article to you. Well, there the bell goes, folks. It's time to get on out of here. Look forward. I hope you have a wonderful weekend. I'll be back with you on Monday. We'll have at it again. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group.